Uh, Good morning, everybody. We're going to go ahead and get started. My name is Barry Hudson, Director of Public Information for Montgomery County. Today, you're going to hear from Dr. Travis Gayles, the county's health officer, as well as County Executive Marc Elrich. So we'll start off with County Executive Marc Elrich to give some opening remarks and answer some questions.
Hi, I would talk through my mask, except you guys wouldn't be able to hear me, and that would just make this worse. I just wanted to, I'm really happy to be here today. This is the opening of the state testing site in our motor vehicles facility here in White Oak. It is not the first site in Montgomery County. That's been a misstatement. It is the second site, because MedStar's had a site open in Bethesda. That was one of the first sites to open anywhere. So now we have two sites in Montgomery County. There continues to be some private testing. I know I'm a Kaiser person, and Kaiser is also doing testing. So there are multiple avenues now for people to get tests. But all of these sites have in common is you have to be referred or have a referral from a doctor. So there's a process you go through. You get a referral. You contact the state about getting an appointment or a time to come. I think it's an appointment or a time to come over here. And that keeps it orderly. It keeps cars from stacking up. And it keeps people from coming in hoping they can walk in. This is not a walk-in testing site. This country, this county, and this state do not have enough test kits to do walk-in testing yet. We just do not have that capacity. Those kits aren't out there. We're continuing to try to get kits at every chance we get, as well as all the other PPE gear that you're hearing about and ventilators. So our office is working with the state and also independently to secure personal protective equipment for our own workers, but also for nursing homes. We're coordinating with the state and the state's ability to provide us supply. We are obviously in competition with all the other places in the country that are having the same crisis and the real dearth of equipment that's available in this country. So we continue to try to do everything we can. We are hunting down every lead we can. I have sent leads to our people to look to follow up on. I know council members have. Private citizens have called in or written in and said, we think we know where you can get stuff. We are leaving no stone unturned in trying to find the equipment that we know everybody needs. Meanwhile, we're sending over to the council today the language on the economic stimulus package that involves money for individuals and involves money for businesses. We're not putting it out until we've got an agreement with the council that this meets their objectives, but we're trying to provide support for as many small businesses as possible in the county. We've put aside about $20 million for the small businesses, $1 million for the nonprofits, and $5 million for individuals. We know this is not the end of that process, but it's more or less the beginning of that process, and we'll continue to make adjustments as we go along. There are two important things, since I've got a microphone, and I want to remind people about this. The world of unemployment has changed, and a lot of people who were sole proprietors or 1099 employees or were what we call people working in the gig economy, like an Uber or Lyft driver, who have never been eligible for unemployment. They don't think they're eligible now. This is not true. Under the changed regulations, people are now eligible for unemployment. The other thing that's changed is the amount of unemployment. The federal government has added $600 flat per check. And so just to put it in context, the maximum in Maryland until now was $430. The average in Maryland was $385, the average for unemployment payments weekly. The new number would be $985 and $1,030. This is enough money to basically replace the income of somebody making almost $60,000 a year. So the unemployment is real now. It should help people deal with rent and all their other needs. Particularly if you're in a group of folks who are earning less than $60,000 a year. So I encourage people, do not assume you're not eligible for unemployment. Start with the assumption you are. You may run into glitches and waiting lines because obviously there are millions of people accessing this now, but they will handle this and they will get through it. And we want people to be able to take advantage of it. At the same time, in the business world, the Small Business Administration is starting to process loans. There's $10,000 that people are eligible for. That's a flat-out grant. They're not doing vetting. They're not doing the usual loan review in the case of putting out this money. In addition to the $10,000, which is available with very low criteria, there's additional money from the SBA coming out. And if you're an employer and you keep your employees, you keep 75% of your employees. This is a big one, pay attention. If you're keeping 75% of your employees, the federal government will pick up your payroll costs and your rent and your expenses. If you lay your employees off, you can get a small business loan. Your employees will get unemployment. You can get a loan from the SBA to cover rent and some of your expenses. And I'm not an expert in that. I can tell you got to go through the process. But if you could get the rent and your utilities and things paid for by keeping people employed, it is a very good deal. And so I encourage people, if you're a small business person, do not assume that this is the SBA you knew before, that this is going to be a long, drawn-out process. They are expediting things. I was on a call with our congressmen and senators yesterday. Everybody's encouraged by the process. There are some glitches to work out, but there's a lot of support out there, and we're providing as much support as we possibly can. But I want people to know what's out there and what's available. So with that, I'm going to turn this over to our Chief Health Officer, Travis Gayles.
Thank you, County Executive Elrich. Good morning, everyone, and thank you for coming. We are excited to be able to stand up this opportunity to provide testing to individuals across our county and actually across the state. It's not resident specific, to be able to provide that service. Our expectation is that moving forward from today, we will be able to offer this testing opportunity multiple days a week. So please stay tuned for those further details after today's event. I want to emphasize that this is based upon physician orders. All physicians across the state have the opportunity to utilize the CRISP surveillance system to order tests for their patients, and the patients get a link to schedule their appointment, and they come in and receive the service. At this point, we are providing the support for the test, and moving forward, we expect to continue to do so. And we hope that, again, recognizing a large part of this is based upon testing capacity, we are working, as the county executive mentioned, we are working to secure those resources to make sure that this is a consistent, substantial opportunity for individuals across the state, particularly residents of Montgomery County. I know there are probably lots of questions about this and other issues, so I will stop there and will be happy to entertain any questions that you have.
Dr. Gayles, there are no set days. This is not Tuesdays, Thursdays, Monday through Friday. It depends on the number of kits and what have you that you have access to.
What we're aiming to do is to hopefully stand it up on Tuesdays and Thursdays during the same time period. And certainly as our opportunity to have more test kits available and testing capacity increases, to be able to increase the number of appointment slots. Our goal would obviously, well, not obviously, but we hope to be able to do as many collections as we can. But the ultimate goal is to probably look at a system Tuesdays, Thursdays between the 10 and 2, 11 to 3 time period.
Do you have a certain number of kits right now? Like do you have 100, 500? Like do you have a finite number starting this morning?
Well, we have capacity to test approximately 100 individuals today. And that is what we are looking to be able to substantiate when we, at a minimum, when we open up and provide the resources on those other days.
Did you mention, is this Montgomery County residents only, or is it Maryland? Anybody lives in Maryland?
It can be anyone who's a resident of the state. Obviously, given that we are a Montgomery County location, we hope that Montgomery County residents are taking advantage of the opportunity. We have particularly emphasized this to a lot of our safety net clinics that have not up to this point had the resources to be able to offer, because we recognize, even in our push in saying we want to get more people tested, that a lot of people still remain locked out of the current system. They don't have a primary care provider, or they may not be able to navigate the healthcare system, whether it's primary care offices or urgent care facilities, to be able to secure those tests. So our goal is, again, to create a low barrier entry point so that folks who need these tests can get them with the least amount of obstacles possible.
Dr. Gayles, if you're calling your primary care provider or going to a clinic, is there any type of financial incentive, or is there a lower cost of going to one of these state VEIP clinics as opposed to one of the major hospital groups, just from a financial point of view if money is tight?
Well, the reality is the Secretary of Health, Secretary Neal, put out a directive a few weeks ago that said that we should be offering and extending tests to individuals who meet the clinical criteria, who need it, regardless of their ability to pay and their insurance status. Now, each site does things differently. The site here, we, at this point, are absorbing the cost and looking at ways that we can utilize, for individuals who do have insurance, bill their insurers, because, again, working from the federal level to here, there have been directives put into place for companies to absorb those costs. So again, every model is different, but what we're working to do, and this is consistent across all of the different state sites, is again to create a low barrier entry point that is of minimal cost to the resident, to make sure that individuals are getting the service and not allowing their insurance status or their ability to pay to interfere or discourage them from getting tested if they need it.
This site, if you don't have insurance, you won't be on the hook for the cost of the test.
No.
And I have heard reports that some of these tests are thousands of dollars if you don't have insurance. Do you know in Maryland, roughly speaking, or if there's a range, what these tests are costing because of the supply and demand?
Well, I'm not sure where the thousands of dollars are coming, but certainly we recognize that dependent upon the venue you seek care. So if you're utilizing emergency room space, the level of care and cost of care there would be significantly higher than utilizing an urgent care facility or primary care office. The actual tests themselves, to get the kits and to run the analysis, I think I've seen costs as low as in the high 40s, low 50s range, upwards to about $90. But the average cost, I think, for the labs is around $50 to $55.
That is the National Guard that's assisting here?
Yes.
And do your people have enough PPE to keep this going?
Yes, so...
However long?
Yes. So this event is done in partnership with our colleagues at the State Department of Health, and they have helped coordinate this event and coordinate with folks like the National Guard to be able to provide those support services. It is a true partnership in terms of what we're both providing. We as a local jurisdiction are providing the test kits and the staff to be able to administer the test and then send those tests to the different lab agencies. But it is a true partnership. We do have adequate PPE supply to make sure that the individuals who are collecting the test, as well as providing the support services, have the resources that they need.
How long do you get the test results back?
On average, the private lab results are about 48 to 72 hours.
I recently got the email from NIH saying, hey, if you think you've had COVID-19 or you have given blood, can you give platelets to help in their studies? Is there a place to go if you're feeling fine but you're wondering, I was sick in January, could it possibly, to get this blood test that's available supposedly out there?
I would recommend, if individuals fall into that category, to contact your primary care provider to get further guidance. And what he's referencing for folks at home is that we think, or we're hopeful that for individuals who have had COVID-19, who have convalesced well, who are doing well, and have cleared the infection, we are hopeful that their body's immune response to that, meaning that they've developed some antibodies as a result of that, we're hopeful that by collecting that plasma and those antibodies, that there may be able to, treatment modalities may be able to be made utilizing those antibodies to mount and create a treatment for those who have COVID-19.
So where do people go if they're interested in maybe doing that?
I don't have that information out, but what I would say is, again, contact your primary care provider. We'll look to include some of that information on our county site to make sure that people have that available.
Secretary, you mentioned that this test site will allow about 100 people per day to get tested.
That's our goal.
I'm wondering what percentage of that, of people is the same?
Well, we're adding, hopefully, I mean, trying to get as many people possible with a minimum, hopefully, of each day of 100 folks. I don't know what percentage of that is. That's our goal. And certainly we're continuing to encourage private providers to order through their mechanisms, through private laboratories. Again, recognizing that the state public health lab, those tests are being used for priority cases, priority being defined as individuals who are hospitalized, who are significantly ill, individuals who we consider to be vulnerable populations in our nursing homes, our healthcare workers and first-line responders who have been exposed, recognizing that a timelier diagnosis could significantly change the treatment regimen of the individual, as well as determine if others have come into contact, again, for healthcare workers and our first-line responders.
So do you have a sense of how many people in Montgomery County are being tested?
No, I do not. And so to that end, I want to add another question to that to inform folks at home. So we've struggled with the denominator from the very beginning, because if you remember, we were only testing folks through the CDC and the public health lab. And then once private labs came online, at least in that immediate window, that first 7 to 10 days, it was difficult to get an assessment of how many folks were being tested that way. Now all of the results are being fed into the NED surveillance system, which is where we pull our cases, so we get negatives and we get positives. So we're able to kind of come up with an approximate number of how many tests have been ordered during that time period. I think at this point, and again, I could get that information to you offline because I don't want to put out a wrong information, but we know that multiple thousands of folks have been tested in the county so far. But I don't know that specific number, but we'll be happy to share that with you later.
Gayles, how many drive-through testing sites are there? I'm aware of this one now and one at Suburban Hospital, but in Montgomery County, how many are there online currently?
So as the county executive mentioned, this is the second. The site in Bethesda was through MedStar. And I think there may be some other smaller pop-ups, but the ones that have been formal and official, I think this is the second one.
This is the 5th vehicle emission station.
Yeah, so the fifth vehicle emission station across the state. The other sites are, the first 3 were in Charles County, Glen Burnie, and Harford County. And those continue, and then the other 2 that came online today are our site, and then there's a site in Columbia and Howard County.
Dr. Gayles, from what you've seen over the last few weeks, how long does it take from when the physician files into the CRISP system requesting a test until the patient actually is able to come to one of these drive-through sites or to another site and be tested? What does that time frame and that window look like?
So it's very quick. So if I'm your physician, and I would recommend you get another physician because, I'm just joking. But if I'm your physician ordering your test, I order it in the system and put in your information, contact information, and then it kicks you out a link for you to then be able to go in and schedule. So it's fairly quick. I won't say instantaneous, but it's fairly quick turnaround.
You may answer, besides the National Guard, the lay people we see here, are those state health department employees, or are they county, are they nurses that have been contracted?
It's a combination. Again, as I mentioned, that this is a partnership with our state folks. A large part of the staff who are collecting the samples are county employees. Again, we also have some representatives from our police department helping provide security, traffic control, and a presence here, working with the National Guard. And we do have some staff members from the state helping coordinate the event as well to make sure everything runs seamlessly and smoothly.
Dr. Gayles, can you just briefly explain, when somebody comes, do they just give their name and they check in the CRISP system to verify that they're a registered patient, and they have to present some form of ID? Can you just talk a little bit about that? Yeah, so we try to, again, make it minimal in terms of the types of forms or documentation folks need to do. But once you're in the system, there's an electronic system. So the person, going back to other question, the person scheduled in, your name gets there. What's your name, for example? Yeah.
Dan. So Dan's name is in the system. You come in and say, my provider ordered it. We're able to go in and check and confirm it with your identification, and then you move through the line.
What forms of ID are acceptable?
I think any whether it's an identification card, a driver's license, social security card, again, anything just to confirm that you are who you are. A photo ID.
When you mentioned earlier that Montgomery is absorbing the costs clarify, is that just the cost of the test or are there other costs associated?
The biggest cost associated with this is the cost related to the patient is the cost of the lab test. So the rest of the resources we're providing, again, in consultation with our state partners. So everything else is being done and at no charge to the patient.
So the commercial test, the county is paying for.
At this point, yes.
A couple of off-topic questions for Executive Elrich. First one, where do things stand with your proposed property tax as it was proposed and in light of this?
As it was proposed pre-crisis and pre-recession, that money was designated specifically to deal with the schools, and the amount that they went over last year's spend. And so we didn't have enough money to go that far over. We proposed the tax. The council doesn't want to raise it, so if they don't raise it, then the schools won't get more than the maintenance of effort, and that tax won't be there. So it's a council's decision. I understand why they would make that decision right now. I will point out that Howard County just announced a tax increase proposal in order to pay for schools they need. I'm trying to look beyond this immediate crisis, because when this is all over, and it will be over, you've got a county to run, you've got an education system to operate, you've got goals for trying to close the achievement gap, and so all that stays the same before coronavirus and after coronavirus. But I understand the pressure people feel right now. There's an uncertainty about what our costs are going to be in this, though we know that the federal government will be sending the county about $181 million to deal with costs. We are dutifully counting up every single dime we're spending that wasn't in the budget that's directed to Corona, so we're hoping that it has a minimal impact on the budget. It'll have a greater impact on tax revenues next year, but not this year, because if people have some impact this year on withholding, but not so big as this will have next year on actual incomes, because this is that period when people's incomes are really going down. So I'm going to support whatever decision the council makes on that. And if that's out of there, then basically we've got a same services budget with some enhancements that we were able to include and some changes we think are going to address some of the long-term, I'd say, systemic overtime issues in the county. So we're hoping that we can deal with the school issue and then look at the budget as kind of consistent with what we've been doing.
And secondly, what can you do, are you doing to make sure that any kind of county meetings remain open so that there's some kind of dialogue, or at least the community is aware of what's going on? So
I've done a couple of town halls. I'm about to do a renters town hall. I'm probably going to park over there in the hill and do it from over here. So we're continuing to have outward communication. The council is, meeting in Zoom session, I think, or meetings like that, team meetings, one of those processes. The stuff's available on the web. It is an imperfect system in terms of, recognizing people and people having enough notice. But hopefully after a while, people will realize how the council is conducting their meetings. I was told they're not doing committee meetings because they can't all be broadcast at the same time, and so the council's acting, I think, as a body as a whole. I know they're talking about their procedures, I think this afternoon, so you'll know more about that soon. But we're trying to be as open and transparent, and putting out press releases and everything else we can do to get our message out to people in the community. Yeah. I mean, the things we do are informed by what people, kind of tell us the issues are. We set up guidance for both the individual assistants and the business assistants. Part of what we're doing is based on what people told us. I mean, we got a very strong message from businesses from the beginning that what they need is grants and not loans. Because, and think about it, if you're closed for 2 months, hopefully, no more than that, maybe 3, and then you want to open up, and if someone's going to not only you're going to be presented with bills for your back due rent and your back due everything else you couldn't pay when you're earning money, if the government offers you simply another loan on top of the loans you already have, people may just flat out give up on reopening. That's the good thing about the federal program. So much of it is in grants. That first 10,000 is a flat out grant. The other big part is the fact that if you keep your employees, the loan turns into a grant, and all of a sudden your rent and your operating expenses are largely paid for. I know it sounds too good to be true. It sounds like nothing this government has ever done. That is true. It's nothing like we've ever done before, but it's an appropriate response to this crisis, and they're working already on what's going to be a third step. So I'm encouraged that people are doing the right things so we can actually emerge from this economically more rapidly than we would have otherwise, and frankly, more rapidly than I thought we were, 2 weeks ago, 3 weeks ago. So it's a changing landscape, and there are lots of people working.
Marc, we had reports today that the federal government is considering another stimulus
Yeah.
bill. I'm wondering, on the local level, are you thinking about adding anything to the 25 million that's already been?
I'm always thinking about adding 25 million. We're going to see how far it's going to go. We'll see who doesn't get helped. We are requiring people to apply to the federal programs because what we want to ensure is that business reopen. And if I just write you a check for some stuff and then you're going to close your business anyway, that doesn't serve. If I've got to prioritize, and we've got to prioritize, we want to make sure the aid goes to make sure that when this is over, somebody can open their doors up again. So I'm sure we're going to be going back asking for more. I'm sure that $181 million will help pay for part of that. That's hopefully what we're going to use some of it for. We want to make sure that we're actually effective in what we're doing. We took a week to try to work on regulations. It would have been real easy to say, just write a letter and we'll write you a check. We want to make sure the money goes out effectively and that it has the benefit to the business community that we wanted to have. We didn't want a few people to gobble up all the money. $20 million doesn't go very far. If you gave everybody $50,000, which is below our cap, you'd help 400 businesses. There are thousands of businesses in Montgomery County, and a lot of them have rents that are the matters of a couple of $1,000s a month. So we want to make sure that we can keep the enterprises going and that they're incentivized to open up when this is over.
Executive, I've heard that a number of individuals at Montgomery County Police, possibly the fire department too, are now working remote. Brass, SAT, traffic, people like that, non-patrol based. Have you heard the same, and can you explain a little bit about that process?
Yeah, we've remoted everything we could humanly remote in the county. So if you were somebody who's came in and did a desk job in the department, then we can have you do a desk job from your desk at home. We're doing that, and that's across the board in the county. I forget the number, but it is an astounding number of workers that we've been able to have working from home. And if you think about it, it's a great lab experiment for us, because if people are able to work from home successfully, then we're going to encourage more remote working. We've been talking about this for years. The county's had a policy for years supposedly encouraging teleworking, and then we virtually never implemented it. You could count on maybe all the hands here, all the people who teleworked, and this has made us rethink that. It has big implications for our operations. If you could effectively telework, then I don't need to rent as much space or own as much space to put people in. I could reduce the operating costs of the county government as long as the productivity of a teleworker is essentially the same as somebody coming into the office. And that's the balance that we have to work out. And we're working with the unions on this. I mean, everybody's got a stake in making this work. And frankly, I think the private sector is going to look at the same thing. If they were able to successfully telework, people may well allow more people to telework. And on the one hand, that will reduce their operating expenses. On the other hand, it'll increase the amount of vacant space in office buildings, and that's a challenge. But I think, the world evolves, and this crisis is going to have some effect on how we evolve.
Would you say the majority of Montgomery County employees are currently teleworking?
I don't think it's the majority, but it's a hell of a lot of people. It's substantial. I can get you that number. I think Andrew could probably get it to you if you asked him.
Two more questions, that's it.
For Dr. Gayles, the state is reporting this morning that there are now 21 COVID-19 deaths in Montgomery County. The last I checked, we knew information about 6 of them. Do we have any more information about the other 15?
Once we have a complete, there's levels to that. So once we have more information about the respective cases, and we also know that all of the families have been properly identified, we will be releasing more information about that to the public.
Do you have a sense, Dr. Gayles, how the hospitals are doing right now? If there was, like you were warned this week, next week could be really rough. If there's a bit of that, Suburban, Shady Grove, are they all like at their limits right now, or is there still room before you got to pitch tents and cots?
Okay. Right. So I want to take actually advantage of this opportunity to level set again for folks at home what we're talking about. So there's two things. There is this notion of what is a surge, which is the formal term for what you're describing, but then also what you're describing and or talking about, what we have to look forward to. The reality is, and we've been very clear from the beginning, that cases are going to increase. And we talked about how we're looking at cases from other areas, then looking at the number of cases here, also looking at different types of transmission, but then ultimately as the numbers increase, what percentage of folks are being hospitalized, which gives us an indication of what's the severity of the symptoms and what's the need, and also to the earlier question, the most recent question about fatalities. What we're talking about forecasting for the next 7 to 14 days or over the rest of the month is getting a sense of what the significant impact of that increase will be. Will we see, as the number of cases increase, as we test more people, what's the percentage of those folks needing to be hospitalized and require additional services? At the moment, the majority of our cases have been able to convalesce at home. They've not required hospitalization. We do know that, I think as of this morning, 26% of the COVID-related cases across the state have required hospitalization during their course of illness. So again, that suggests that the majority of the cases so far, and it's consistent here in the county, have not needed to go into the hospital. We expect that could potentially change, again, as the numbers increase. So that gets to the second part of your question. Are we ready and are we being prepared? So we've been working with our hospital partners since this began. They've been working individually and we've been working collectively to address their concerns, to see how we can increase capacity within their respective centers. We've taken a multi-tiered approach. The first tier is looking at implementing policies to encourage bed space, such as canceling and postponing elective procedures, those kinds of things to free up beds that would normally be used for other things that could be repurposed for this purpose. We're looking at how we can reconfigure the spaces in the current blueprint of each of the hospitals to maximize space. In addition to increasing the bed space at that level, we also have to change the percentage of beds we have that provide basic hospital services to be able to ramp that up to critical care services and intensive care services. So in addition to the bed number that we're looking to increase, we're also looking at that percentage. Historically, about 12% of the beds in our hospitals have been critical care ICU type settings. We're trying to increase that percentage to 25%, recognizing we may see, again, a significant surge in folks coming to the hospital, but then a significant increase in the number of folks requiring critical care services. And so the second tier and the third tier of that process has been, we've also been looking at how we can build out spaces within the current footprint. And then the third component is looking at other spaces where we can flex and surge capacity, whether that's in old hospitals or existing facilities, or if we needed, we'd have to look at some other alternative sites that have historically not provided clinical care to be able to potentially house mobile hospitals or, in worst case scenario, cots and those kinds of things to increase capacity. But I can tell you at this point, we are not at capacity. Each of the hospitals monitors their bed counts as well as the percentage of critical care beds on a daily basis. We talk regularly, and we've been in constant communication of different strategies that we can explore to expand their footprint. We are hopeful that by the end of the week we'll be able to release more information related to that. I can tell you part of our team is actually out doing a site visit at a number of sites now to look at and explore other alternatives, and the hospitals have been great about looking at their current spaces as well as being innovative and thoughtful in exploring some other places and potential campuses to provide the resources that we need.
Thank you.
Thanks. I'm just curious, people here at the Baltimore Convention Center, Central Park, has any place been identified in Montgomery County? If all hell breaks loose, we're taking over Cole Fieldhouse, that's in Prince George, but we're going to take over the tennis bubble on Democracy and
Right.
fill that with guests.
So we're being very thoughtful and careful about how we approach this, because the reality is when we're looking at those places, they require a lot of resources. So we are vetting different venues to be able to provide those services, but the first step is we have to look at our current healthcare facilities and look at how we can maximize space there, because when you're setting up those alternative sites, you've got to turn around and you have to introduce oxygen and bed spaces and ventilators and all those things. So our first go round and our first strategy is to look at those spaces that historically and currently offer those services, how we can maximize those spaces, get the resources they need in those settings. But certainly, yes, we're keeping a mindful eye out on identifying other resources such as those places you identified.
Thank you.
Thank you all.